All right, we are back to another Wellbeing Wednesday. Welcome back for those who have been here, and for those it's your first time, welcome. And we are sure you are going to enjoy this today. This is the monthly segment that shows child care providers and caregivers like you all simple ways to support your own well-being, because taking care of ourselves is, in fact, taking care of others. Whether you're an early childhood educator, a director, a parent, someone who just feels like a parent some days, you're sure to pick up tidbits of actionable advice about how to support your overall well-being and get back to feeling like yourself. I'm your host, Susanna Creed with Be Well, Care Well, Arkansas, a curricular concepts program that's all about supporting the well-being of our child care providers. We have Terrah Graves and Victoria Spradley joining us today, and we'll get into a great conversation with them in just a moment. So as you all know, for these Wellbeing Wednesdays, we usually pick a monthly theme to kind of focus on the different dimensions of wellness and really expand our idea of what does it mean to take care of ourselves and what are the different ways that we can do that. So it's August and it is back to school time. And with the new school year comes new beginnings and sometimes new stressors. So since this month's theme is stress awareness and stress management, we want to help everyone, caregivers, parents, teachers, feel better prepared to handle these new stressors. So as I mentioned earlier today, we have Victoria Spradley, who's the outreach coordinator for a program called AR ConnectNow. And we also have Terrah Graves, who's a licensed clinical social worker with AR ConnectNow as well, who will share more information about this amazing program that is free mental health for any Arkansan, anybody residing within the borders of Arkansas. And they're also going to talk about some tidbits of advice, how we can support and manage our stress, maybe during the time of a bunch of new beginnings. So thank you so much, Terrah and Victoria, for joining us today. We really appreciate your time. And I figure we'll just get into it. And we'll start with you, Terrah. We had talked about kind of the difference between stress awareness and stress management. So I wanted to see if maybe you could kind of shed a little light from your perspective on the difference between the two and why looking at both is important.
Yeah, well, I'll start by saying, so my perspective is actually a licensed master social worker at this point. I'm close to the clinical point, but I just wanted to, let everybody know that I'm still at the master social worker point.
Yes, that is my bad.
No, that's okay. It's kind of confusing how that works, but I'm a therapist at ArConnect, and I really love our program. I love the variety. I get to talk to a lot of different people dealing with a lot of different kinds of stressors. Also, I'm a parent, so I have a lot of experience with children. Also being a single parent, I do a lot of caregiving. I do a lot of childcare swapping. So I've got a lot of caregiving experience. I know how stressful it can be as someone who doesn't just like isn't naturally inclined to caregive. So I've had to learn a lot, teach myself a lot. And I'm so thankful for all of the teachers and caregivers that my son has had that really take their job serious. And I'm super impressed with how much they take on a daily basis. Definitely underestimate the amount of work that they do regularly.
Yeah.
So as far as stress awareness and stress management, like the difference in those things, I really liked the way you separated those out, actually, because a lot of the work that we do in therapy really are those kind of like step process. So first we kind of work into awareness. Like a lot of people come in saying, well, I don't actually know what's wrong with me. I just can't sleep. I can't eat. I'm nervous. I'm anxious. I have tension in my body. I'm crying all the time. Like these are kind of really common symptoms of people who are just kind of overworked, overstressed. Yet they have no idea that maybe they are suffering from anxiety overload or, even depression, things like that. So the awareness piece is really important. So stress management kind of comes after we build some awareness of like how these symptoms are showing up and maybe why and where they're stemming from, and kind of building new, I know this is a very like cliche term, but like new coping skills, new strategies. But it's true, because once we can identify where those things are kind of coming from, it's easier to kind of plug in like, oh, I know that when I'm getting too worked up over this, or when I'm feeling really emotionally kind of activated by a child in my classroom, or whatever it might be, that I need to take a step back, and maybe I need to go to the gym or take a walk or treat myself to a nice meal, or whatever it might be, that you can kind of directly correlate like these management skills with this new level of awareness of what's happening, if that makes sense. So those are kind of the difference of like awareness and management. And again, two of the main things that we work on, especially like at our Connect, when we're doing like more short-term therapy, before you kind of go on to like longer term, which is going to do that real deep dive, what was your relationship with your parents like, things like that. So with stress awareness and stress management, when we're talking about awareness, so a lot of what we know from research now is really just kind of like reiterating a lot of almost what we might call like ancient knowledge, like building awareness of our body through mindfulness, and techniques like noticing, becoming present in the moment, using all of your five senses to check in with how my body's feeling. And because normally we're just really caught up in these pressures of like, what am I accomplishing? What am I doing? What am I doing wrong? Like, how is this working or not working? How could I do more? Like, this is a lot of like the messages of our culture. So really kind of bringing yourself out of those really intense pressures and thoughts, and just, again, noticing, being present in the moment. So building that skill doesn't have to be done through like years of meditation. Like it can be done in ways of kind of mindfully walking, right? So like I think about my feet on the ground, or I think about, what my body feels like when I'm sitting in this position. It can be things like body scans. So you start from your head and just move all the way down. Like, where is the tension and can I release it? Where's the resistance? Things like this. And then of course, meditation is always a good option. If you can do breathing exercises or just find a meditation that works for you. There's all different kinds. And actually, let me just, before I go any further, share this with you, because can you see that?
Yep. Stress awareness and stress management.
Yes. Okay. So that we're right here at this different types of meditation. So this all came from a thing called mindfulness-based stress reduction, is kind of where we get this idea like that we don't have to just use meditation, like oming, all these things that feel kind of awkward to a lot of people, that we can incorporate this into our really busy schedules, which is awesome. And all of it, while also is a form of management, because it's bringing your nervous system kind of at like a more even point, is still building awareness for overall mental health throughout your life. So that's kind of a win-win situation there. But next, I always really, really highly recommend education, because I think one of the big differences between today's world and like, let's say even our parents' world, millennials, like millennials parents, we have education, we have resources about how our brain works, and that is huge, right? So we can now know why anxiety is so common. We know why depression happens. We know why a lot of times we have troubles within a relationship, because we know things about attachment and how that's built. All of these are things we didn't necessarily know, or like the general public didn't have information about just like 20 years ago. I mean, that's huge. So we know so much more about the human experience. So reading books on psychology, neuroscience, listening to podcasts, whatever, floats your boat, as they say, right? It doesn't have to be like sitting there reading this really long text about anything. It can be a 20-minute podcast. And the thing is, like, I have some recommendations on the next slide, but you can just Google a lot of things. And even though, of course, like, be somewhat discerning because it's the internet, but there's a lot of really good resources out there too. So it can, whatever particular ailment or struggle you're having or wanting to learn more about, you could probably find a really good book written about that right now, and research and things like that.
And I do really like the even just like the mindfulness and noticing, that's a very difficult thing. I feel like, especially in American society, we don't really pause a lot, and notice. If we do pause, it's like intentionally to reflect with a purpose. Like, it's got to
Right.
have a
Right.
purpose. It's got to be driven. It's got to be the next thing, which is fine to an extent. But, just this idea for me, even like it's come up recently, like I really need to practice mindfulness without reactivity, which is very difficult for me. It's not comfortable and it's new. And I know something that I hear from a lot of our caregivers when we talk about things like this, and I'd love to get your take on it. And maybe I'm jumping ahead, so let me
No.
know. But this idea that, we practice mindfulness or meditation, it's like, oh my gosh, I can't get my thoughts to calm down. Oh my gosh, my thoughts are still there. What's happening? Why can't I do this? And we end up getting so frustrated by the whole process. And I've noticed, especially we as women tend to turn that internally and be like, what's wrong with me? I'm doing it wrong. I'm not doing enough. And so, especially for maybe people who want to practice this or try this, but also who tend to get really frustrated and kind of internally judging themselves throughout this, what are some ways that somebody like that could go about starting to practice this awareness and this mindfulness?
Yeah, those are great, really important points that you made. For one, you mentioned this idea of like kind of as a gender, women are kind of taught to self-analyze and self-criticize a little bit more than most. So instead of like kind of being defensive a lot of times about like, no, I'm not doing anything wrong, there's nothing wrong with me, like we're actually taught to do kind of the opposite. Like, how can we accommodate? How can we do more? We're never really doing enough to serve or help others. So that is a common thing. And so and then of course, like you have this pressure of kind of our economic system and the way that our society works in that way, where it's like production is the most important thing. So when are you able to just kind of sit back and say, okay, this is a time when I don't need to be producing anything or like being successful. So and in mindfulness-based stress reduction, they would call that like moving from like drive mode, right? Like you're in drive mode all the time, to more of like a relaxation mode. Like, when do you allow yourself to kind of sit back and enjoy the fruits of your labor, to enjoy what you've accomplished, to be grateful for the things that you have accomplished, right? So and then the second part of that being when you're in a state of mindfulness or trying to incorporate meditation in your life, we can't expect that those ways of thinking, those habitual thought processes, are just going to suddenly stop. In fact, that's kind of why we're doing it, right? It's like those are going to continue on. And so what the purpose is not to make those stop. The purpose is to kind of somewhat detach from the judgment of that. So instead of saying, oh, you stupid dummy, for not like focusing on meditation, you got pulled away by your thoughts again. It's the gentleness of bringing yourself back to the task at hand of like the meditation, the mindfulness, is almost key to that process. You're detaching from that judgment and that meaning that you're adding to what you're doing. And like you said, that really ultimately helps with your levels of reactivity, because when you can practice detaching from the meaning your brain automatically wants to assign to something, that carries out in all areas of your life: parenting, job, romantic relationships, all of the things. So does that answer your question?
I think so. I honestly, if you see my face, it's because I'm like, ooh, like, has she been in this room with me for the past week?
Yeah, this is the human experience today, for sure.
Yeah, and it is interesting because so much of the time we're like, I mean, again, it's the whole question of what's the meaning of life. We're always looking for meaning, and that's one of the gifts of being human. But also, it can be very difficult because we're like, oh, I have this thought, oh, this isn't working. What does that mean? Does this not work for me? And I very much so am like that. Like, as soon as I try something, if it doesn't work consistently in like a couple days to a week, I'm like, well, that's not working. That's part of why I made the face. I was like, oh, that's like, it took me several decades to build up these thought patterns and these processes and these coping skills. And so Yeah, it is that
Which is
loving
a great
kindness
point.
of,
Yes. That patience that you just mentioned, that like I have so many clients come in and say, well, last week I was good, this week I've basically like, they're like, I failed at being mentally healthy. And I always try and make a point in all of my therapy, beginning and end, that this is a process. It takes time. Again, like what we know about the brain is that it takes practice and time to change the way our brain works. So everything you're doing is practice. You're definitely going to get caught back up in those thoughts again. That's going to happen. Like that's for sure. And every time you can gently bring yourself back to the place where you feel more at peace and more at ease and more present, every time is just an opportunity to practice that new way of being and thinking. So it's really, it's like a win-win. You're practicing way of being, and as long as you can gently bring yourself back, then that is an important aspect of that. Which brings me to something you said, and we can kind of move to this stress management piece, assuming we're close to time here, which is
we're doing well.
Okay, good. Which is that this meaning of life thing, right? So I think that's the other part of this awareness, and the thing that therapy really helps with is to look at the meaning that we've added to life based on our childhood experiences. So this thing where at the end here where I say like schema exploration, like schema is the narrative we hold about life, right? It's the way that we look at life. It's the lens we look through which we look. It's the filter that we add to everything that happens, and being able to explore that with a therapist, or even on your own through education, right? And mindfulness is a really, really good way to build further awareness, and even like, again, detach yourself from those things and be able to see the world in a different way, in ways that you hadn't seen before. So a stressful situation might look very differently if you took away all of this pressure and meaning that you were adding to it, right?
Yeah.
So moving into then stress management, you said, well, what's the meaning of life if the meaning that I've added to it is just like arbitrary and based on like some childhood conditioning? Well, nobody can necessarily answer that for you.
We're going to solve the meaning of life, by the way, to everyone watching. Like that's going to happen right here.
Well, unfortunately not. I can't. I wish I could offer that. No, I wish I could offer you that. But I think that's the point, is like when you take away all of those kind of like what we call like ego states, like those meanings that we add out of like, overcompensation or whatever it is, then we can really look more deeply at like what gives us meaning, like what truly is important to us, and you can kind of clear things up. And stress becomes easier to manage when you can hear those voices more clearly, that voice in you more clearly. So things that we talk about, like for meaning, it's all the way at the bottom here, but this like play and have fun, experience pleasure, usually people associate the word pleasure with like just sexuality, because that's just kind of the meaning we've added to it. But when I say that, I mean, like food and wind in your face and swimming and like allowing yourself to kind of feel these pleasures, because if nothing else, life does have that if we're able to be more open to it and able to make space for it. I just feel like I just like quoted the Encanto song. Sorry.
I love it.
That was weird. Didn't do that. So also just kind of like some really practical things to do. Like there's a lot of research about gratitude journals right now. So they show a marked increase in happiness levels. The other thing that really is backed hard by research is exercise. Just really any level of exercise is shown to be even more effective than even like antidepressant medications a lot of times. So if you can
that
just
one,
go ahead.
Oh, sorry. I'm just getting so excited by some of the things that you're sharing. Like, so something that I've been doing recently, and again, I have the luxury in some ways of working from home, and I'm like attached to my computer. So it's a little bit different than, if I was working in early care and education, but there's also ways to work this in as well. Like I've started doing maybe 5-minute exercise breaks throughout the day. I just go on YouTube, type in 5-minute exercise break, and it's like the cheesy ones, but it's 5 minutes. And I'm like, that I can do. And I've been doing those like twice a day. And I notice I feel so much better when I do it. And it's funny you mentioned the gratitude journal, because with Be Well Care Well, one of our trainings is self-care in action. And we talk about 5 different resiliency strategies, and we talk about the research behind gratitude journals specifically for teachers.
Cool.
It's like a count your blessings type of thing
Awesome.
where they did it consistently for 8 weeks. And I mean, you're so right. And the last thing, and this is just something that I found, I'm in the whole thing of well-being, like that's my job. But what I've noticed is I have that drive even with my self-care. I'm in drive mode. It's self-care. I'm actively meditating. I'm actively writing. And I realized, oh my gosh, I don't actually take time for myself for fun.
For fun.
I have an hour, 2 hours in the morning that I do self-care. That is not fun. That is what I have to do to take care of myself. But there's a very big difference. It's a big difference when I'm like, I'm making time to do things and take care, but that is different than just having fun. And so I'm so glad that you put that in there as well. I think so that's super important.
Yeah. And, it's interesting because it actually took me, I'm studying to get a certification in sex therapy. And it actually took me doing one of those trainings to kind of learn that. You don't really learn a lot of times how important fun is and how effective it is outside of, and just kind of like in regular kind of psychological training and things like that. I think because even in that field, we're taking ourselves so serious, like we're professional and we're serious.
I'm a professional
we're adulting. Yeah. Which is probably why the adulting thing is so popular. It's fun. Like adulting, like it's a fun way to look at being professional. Cause we all know in a lot of ways, we're also very childlike. We want to have fun. We want to play. We want to blow off work sometimes. We want to, just enjoy life. And so, it's an extremely important thing to incorporate it. And even for caregivers, I know for me, when learning this or when really incorporating this idea in my life, I kind of took even discipline a little bit in a fun way. Like if my son wasn't doing something, I would, tickle him instead of get onto him and just kind of incorporated fun in that way. How can I think because it's again, that pressure, we have to be serious and make sure everyone's listening, and any place we can really incorporate this fun, I think is beneficial. It's essentially what I'm saying. So, and then I guess to kind of finish off the stress management piece, incorporating self-compassion, so if you did gratitude journal, fun, self-compassion, looking at those critical voices, learning how to kind of again, gently let them go, gently remind them that they're not right. They're wrong this time, or, you're doing something else right now. Incorporating some sense of spirituality, which doesn't have to be anything particular, whatever it is for you. Looking at that connection to the larger picture, not getting so wrapped up in, again, that story, that individual kind of story. Breath work, of course, to really physically calm down the nervous system. Again, we mentioned exercise. Healthy foods is kind of an obvious one, but it does matter. If we're drinking a bunch of caffeine, sugar, carbs, it's going to make us a little more tired and harder to focus.
We could do carbonated soda. One of my coaches introduced me to just soda water and lime. And I remember I was just like, really? Because I don't like seltzer. This is amazing if I'm trying to get in water. We do a lot of water challenges, and I can't tell you how many times people are like, oh my gosh, I've added in just more water and I feel better. My skin is better. I'm sleeping better. I have more energy. It's those little things, but it's this makes me feel like I'm having I don't know if I can say this, but I think I can, a daytime mojito, but that's completely free of any alcohol.
You've never done that. You definitely never.
No. Well, I'm definitely not on this job. But here, it gives me a sense of play and ooh, this is a little special something, but it's healthy pleasure, and it gets it's a little bit of play even with the food stuff. So anyways, this is how I've decreased some of my caffeine.
Oh yeah.
I'll have my daytime non-mojito.
I love fancy beverages. That's what I call them in my house. We have all kinds, all the soda waters with juice and all kinds of fun stuff. And then I think one that's under, it's not given enough credit potentially. And I think it's something that we all kind of have to make an effort to work at because we're not necessarily taught these skills growing up, is healthy relating skills. So just like looking at your relationships and saying, can you manage conflict well? And if so, what could you do differently? And really just like looking at yourself and saying, like, what could I learn about myself within relationships? What could I grow in? What could I change in? Because we all have those places. And sometimes we can get stuck in defensive spaces where we're like, it's not me, it's not me. But truly, it is always all of us at different times. So
yeah,
working on those healthy relating skills, because relationships are really, really important to us as humans.
yeah,
We definitely,
for sure.
our brains work that way. We can't help it. So I think that's the most thing. And then of course, at the next page, I have resources. I listed some of my favorite books on here that I really started diving into back when I first started learning about psychology and things like that. Podcasts, my favorite podcast, because it's short. It's like 20 minutes.
Yes.
So it talks a lot about attachment issues, which I think are really important to humans, again, because we're very relational creatures. And then, of course, our ConnectNow, because we're great. So
I love that. And actually, that was a perfect segue because one, thank you. And for anybody who's watching, please feel free to take a screenshot of this or picture of this. This video will also be up on the Curricular Concepts page, so you can always replay it back if you miss any. But Terrah, this has been amazing. And I think that I want to hand it over to Victoria to go a little bit more into AR ConnectNow because it's such an amazing program. So Victoria, you have the floor.
Awesome, thanks. So Terrah, all of that information honestly just excited me more and makes me want to kind of like dive back into my own routine and make sure that I'm getting the like pleasure out of all my self-care and stuff. So anybody watching, if that excited you or that, spoke to you in any way or you want to learn more, honestly, you should give us a call because we are a free program for anybody and everybody really within the state of Arkansas. So we can assist people with, of most ages, young and old, and any income. There's no criteria to be met in order to qualify for our services because we are entirely grant funded. But we came to be in response to the COVID pandemic, and we really just lasted these few years because we're showing that we're helping people get care that normally wouldn't have access to it. Aside from, keeping people safe from the pandemic, it was also we're reaching rural areas where there are fewer providers. We're reaching people who might have health insurance, but those copays still add up really quickly when you want to check in with a therapist on a weekly or a couple times a month basis. So anyway, we are 24/7 accessible. We're not a crisis line. So, if you call, you won't speak to a therapist right away, but our phones are open 24/7 so that you don't ever have to postpone taking that first step to getting scheduled. If you're like me, you might put it on your to-do list and the end of the day comes and the clinic's closed already. And then it's the weekend and you can't call. And then it's Monday. So yeah, exactly. Everybody's been there. And then it's a couple of weeks go by. So anyway, when it comes to your mind, if you want to take that step, just give us a call. And this 800-482-9921 number is toll free and it's accessible 24 hours a day, 7 days a week, even on the holidays. And we've got a whole team of therapists who can help with strategies for stress management and awareness. Maybe it's trauma experiences or grief, social isolation, you name it. Even if it's not anything that you think is bad and affecting you negatively necessarily, but you really just kind of want to check in with somebody. We're trying to also normalize that just knowing where you can call and knowing that there are therapists, for good, the bad, the ugly, they're here to have conversations and help you just navigate life because they're trained to help you through your thought processes and to develop the skills to overcome whatever you're facing. So I just blurted out so much information about us, but thank you. So if you followed any of that, I hope you'll consider giving us a call because again, we're entirely free. We're for most ages, young and old, and you just have to be within the state of Arkansas. So if anybody's watching and they're in the state on a summer vacation still real quick or anything like that, something comes up, you can use us. You don't necessarily have to be a resident of Arkansas. So that's pretty great too. And then we're on social media. We try to post little tips or tidbits from our therapists, and just general mental health information, upcoming events, places we've been, and who we are getting to meet in the community. As outreach coordinator, I like to try to get us involved with as many programs and opportunities that we can find around the state to distribute our information. So you can reach out to us on our website, on our social media. You can email us, but please stay connected.
Yeah, and again, for providers, this can work for you. This can work for the families you serve, the kids that you serve, your own kids. We've our well-being coaches, all of them for any Be Well Care Well site, have this information and have been giving it out. And I mean, again, it doesn't matter what insurance you have. This is a truly unique and wonderful program. I've heard stories about some of our providers. They were sharing the information with their own family. And I know one of them, their child ended up calling AR ConnectNow, and within a week was not just scheduling to see a therapist, but actually had their first therapy session, I think in less than a week of calling. And they just came back to their well-being coach like, oh my gosh, my child just loves their therapist. This is fantastic. So just truly don't ever hesitate. If you're not even sure if it's right for you, just give them a call. You're not really it's no harm, no foul on it.
One of the things I really, really love about our Connect too is how, as a therapist, is how many people I get who have never done therapy. That is such a great feeling. It's like, and they make such progress so quickly, because again, they've never had that sense of awareness, and just a small insight into the fact that you can have that is life-changing for people. So
and
yes,
like
absolutely.
You said, it doesn't matter what insurance you have. In fact, you don't even have to have insurance. So whether you have it or not, you don't even have to have a referral. You call on your own time and will to get scheduled with us. And I think that's really valuable to a lot of people as well. It just makes it more approachable and more accessible. I mean, like you said, they had a quick turnaround with that patient story, and we love to hear that because we really do try to minimize the amount of time it takes between, first of all, getting scheduled, but then when you do get scheduled, still, how long is it going to take to get connected to the therapist? And on average, our patients are seeing the therapist virtually, because everything's virtual, for the first time, within a week, a business week usually. And that's really unheard of. So we're glad to be able to do that. And one thing that I did forget to mention that does, I think, really help us stand out and also help more people than we realize is that we also can provide care coordination services or resource coordination services, as I like to kind of explain them. And so even if you don't need therapy, but you are looking for the nearest food bank, shelter, maybe you need a respite care program because you're a caregiver for a loved one, or you have a loved one who's a caregiver and you can tell they need some help, like whatever it may be. And going back to school for those who may need help finding some school supply drives, you give us a call and we have a virtual resource center that can help with that as well. We don't physically provide the resources, but we will help people find them nearest them and to minimize, commute and the financial strain of getting these resources. So that's pretty unique to us as well.
And I do have one quick question, just because I've been getting some messages about it. Just people do not have to be an Arkansas resident, correct? Like say their child stays with them in the summer and they're not currently in the state, but for summer, they would like to see if they could get their child connected with AR Connect. Would they need to wait until the child was within the state to schedule, or they just have to be in the state when they have the therapy appointment?
So technically they should be within the state at the time of the call, as well as at the time the services are provided.
Okay.
Now, somebody out in that circumstance, if the child is outside of the state, but somebody is within and they have questions about our program, want to learn more about it, and if it could potentially be a good fit for them, they're still welcome to call and get additional information. But as far as receiving the services, most importantly, but also technically when you are scheduling them, you should be within the state. But that's an excellent point about, split schedules like that. And with schools, people come and go during the holidays, and they have extended time away
Exactly.
from campuses and potentially away from resources that are provided within schools. So that's a really great point, is that, we're year round and we're 24/7 accessible. So you just have to be within the state.
Awesome. All righty. Well, I know everyone's really busy, and I know, Terrah, you have clients to get to. So I want to, again, thank you all so much for joining us today and for sharing some amazing ideas to help myself and everybody else manage stress as the school year is kicking off, and just kind of all year around as well. So thank you. And
thank
of
you.
course, for everybody watching, including y'all, make sure to follow Curricular Concepts on Facebook and Instagram so you don't miss a thing. We post about when our Wellbeing Wednesdays are coming up. If you like today's show, please share it with your friends, family, coworkers, and if you're a child care provider and want to learn more about enrolling in Be Well Care Well, click the link in the comments down below. Thank you all again for sticking with us a little bit over as we talk about this incredibly important topic. This has been another Wellbeing Wednesday. I'm your host, Susanna Crete, and I am wishing you all well. Bye, everyone.
Bye.
Bye. Thank you.